Welcome to Immunity Group podcast. In today's episode, we have two global experts discussing biopsychosocial aspects of food allergies and strategies for managing overwhelm when it comes to food allergy anxiety. Dr. Paige Freeman, Ph.D, is a food allergy therapist and licensed psychologist in the U.S. Dr. Douglas Jones, M.D, is a board-certified allergist and immunologist, founder of Rocky Mountain Allergy, Asthma and Immunology, President of Allergy Microbiome Foundation and FAST OIT, and associations of American physicians offering oral immunotherapy, and also he's the co-founder of Immunity Group Australia. Let's welcome them today. Dr. Paige Freeman, thank you very much for being with us.
Hi, I'm so happy to be here. Thank you for having me. One of my main goals of this is to really normalize anxiety in the management of food allergies and OIT in general. It's a very normal thing to have anxiety. And so a lot of what I'm going to be doing in the beginning is just talking about what the stressors are. So you see that word biopsychosocial there. We're going to be talking about that, and it's important to have a biopsychosocial approach. One of the things that I appreciate about Dr. Jones so much is that he is very, very good at doing this in his practice. And so I am really appreciative of that because it really helps families in a way that is just very helpful. So I'm just going to start off by saying this obviously isn't therapy, and this is just for informational purposes only. And if you're having any specific trouble, please don't hesitate to find your own therapist and also talk to your own therapist and also an allergist. Okay, so to understand kind of the biopsychosocial approach, what it is, it's a mixture of, it's an acknowledgement and understanding of a person's medical condition in the context of not only the medical condition itself, but also the psychological and social factors involved in it. And so the bio part is just a physiological pathology, what is going on in the body. The psychological part is just the thoughts, emotions, and behaviors, such as distress, any avoidance, beliefs, coping methods, and different attributions that a person has about their illness. And the social part just encompasses a whole lot: socioeconomics, environmental, cultural factors, different work issues, family circumstances. This would also be the society that you're in. If you are, I'm assuming that most of you are parents with food allergy kiddos, and that's what we're going to be talking a lot about now. But just all the different ways in which the social aspect of it affects your all's functioning too, in terms of like going to school, how understanding is a school, friends, different cultural events, things like that. And why is it important? Well, it's important because it focuses on the person and the family system as a whole versus just on the illness. And as you can imagine, there are a ton of other factors besides just the illness that are at play in food allergy management. And it's very patient oriented, and it actually leads to better and improved patient compliance and satisfaction. So let me see if I can. Okay, so here are just some of the stressors, and I want you guys, this is not like all inclusive, but because there's so many stressors, it's honestly hard to get to all of them in just one presentation. But as I'm talking about these, I want you all to be cognizant of other stressors that you have and think about the way that these stressors and food allergy management have impacted you. So the food allergy reactions, including anaphylaxis and possible trauma from anaphylaxis, is a stressor, as is the food allergy diagnosis. Sometimes it takes a while for people to even understand what is going on before they may have to see several physicians before they even realize that it actually is a food allergy that's going on. Oral food challenges, having to repeatedly explain the seriousness of the food allergy to family members in the community. Oftentimes, extended family members don't understand or don't accommodate allergies. There can be disagreements about the degree of vigilance necessary, even within families. Checking food labels, I'm not really sure how it works in Australia, but in the United States, the laws can be a little confusing and can change without warning. And so I hope it's better there. Repeatedly having to gauge whether or not a restaurant is safe. The whole family system has to adjust to the food allergy. There's some sibling adjustment. Navigating school snacks, lunches, parties, using EpiPens. 504s are things that we have here in the US. It's a school plan to accommodate the allergens and kind of how to keep the kiddos safe. More examples: holidays, vacations, you or your child feeling left out or not fitting in, missing out on activities, navigating conflicting information, entrusting your child to others, like at birthday parties, childcare, play dates, your child's fears, your child's own fears, anxieties, and worries. Any developmental transition can be very stressful because you are actually having to adjust the whole system and then sometimes your plan surrounding food allergies, and definitely gradually kind of handing the baton over to your child, with the ultimate goal of them being able to manage their own food allergy as they grow. Possibly navigating OIT and SLIT, and just really navigating ambiguity and uncertainty in general. Some possible kind of things that are OIT specific stressors can be just the decision to make to do OIT in the first place, worries about your competency to ascertain whether something is a reaction or not, measuring the dose, missing out, or your child missing out because of the rest period, having questions about what is allowed during the rest period, when your child goes into those developmental transitions like we talked about before. There are pertinent things about OIT that may have to be a little bit more flexible and change, your ability to travel, and some families and children deal with children refusing the dose, which can be very stressful. Okay, so now I'm going to talk a little bit about food allergy anxiety and why food allergy management and OIT management are kind of the perfect storms for anxiety in general. So you can see here that I've got this equation, which indicates that ambiguity and uncertainty plus perceived danger, when both of those are high, it leads to anxiety and avoidance. And kind of just a different way to look at that is when the ambiguity and the uncertainty over here are high, and the perceived dangerousness of a situation is high, that's when you have the highest anxiety. And when you think about it, food allergies typically have a high degree of ambiguity and uncertainty, and also a high degree of perceived dangerousness about them. So let's start off and talk a little bit about ambiguity and uncertainty in food allergies. So I'm just going to go over, like I did about the stressors, about all of the ambiguity and uncertainty in food allergy management. And if you think of something that I haven't mentioned for the stressors, for ambiguity, uncertainty, or the perceived danger that I'm going to talk about later, I would love for you to raise your hand and share them at the end during the question and answer part. What you're going to see in a lot of the slides that I have over here is ask your allergist these questions. I really cannot emphasize enough how much knowledge is involved in mitigating anxiety in the management of food allergies. People are hesitant to talk to their allergist. They feel like their questions may be silly. They may be avoiding things in a way that may be difficult to admit. So it's hard to talk to the allergist, but it is very important. I can almost 100% assure you the questions that you have are not going to be the first time that your allergist has heard them. And they will actually be able to give you good, solid evidence-based information by which to make good decisions for your particular allergic disease management. So some examples of ambiguity and uncertainty. We talked about before the initial food allergy reactions. You may not know even what happened for quite some time until you get the diagnosis. And it's important not to ignore the very real possibility that in some instances of anaphylaxis, some of those can be very traumatic to witness, not just experience, but to witness them. There can be a lot of ambiguity in the diagnosis. With the skin prick and the blood work, you may get different opinions about what they mean, and you may also, the results can be oftentimes inconclusive. There's a lot of ambiguity surrounding oral food challenges. So for instance, questions such as, will my child have a reaction? If my child has a reaction, what kind of a reaction is it going to be? At what level of introducing the food, what amount would they have a reaction? There can be a ton of ambiguity when your child does have a reaction. So these food allergy kiddos oftentimes have other allergic disease that is going on at the same time that can present similarly to food allergy reactions. Also, viral illnesses can sometimes, with a viral rash, mimic a food allergy reaction. So there can be times when you're not even sure if your child is having a reaction or not. Trusting others to keep your child safe. There can be some ambiguity there. Do people understand your instructions well enough? Will your people adhere to the instructions that you've given them? Vigilance ambiguity, just how vigilant do I need to be? Avoidance ambiguity, how much do I need to avoid? How much is reasonable to avoid? And how much am I avoiding because of my anxiety, not because it's absolutely necessary in a way that my allergist would suggest that I need to be avoiding. There can be a lot of uncertainty with food introduction. Will my child or will my child's sibling have a reaction to the new food? There's ambiguity in all the information that you can get, especially on social media and the internet. You can ask, Google in a question about food allergy management, and you can get 20 different answers and not know which is the right one. There can even be some ambiguity across specialties. So you may be told one thing by a general practitioner, another thing by an ER doc, and then something else by someone who actually specializes in immunology and allergy. In the US, I think I talked about there can be ambiguity in food labeling, uncertainty about restaurant safety, and some uncertainty of the potential of other children that do not have any food allergies actually developing food allergies. Some OIT specific ambiguity and uncertainty, but before we start with that, what I want to say is that OIT is typically, at least initially, introducing some more ambiguity and uncertainty with the goal of an increase in long-term certainty and decreased ambiguity. So OIT can be very, very helpful for anxiety, but you may see an initial uptick in anxiety when you first start. And there are some people that really kind of don't ever, their anxiety goes so high during OIT that it's just not probably a good fit for them. But for most of my patients that I see, once there is this initial uptick in anxiety, but then when we're working together and kind of working through it, then that tends to decrease over time. Okay, so you've got the history of all the previous listed ambiguity and uncertainty that you're bringing with you when you start OIT. Is OIT the right choice? The possibility of EOE. How many allergens should you treat at once? Patient-specific ideal maintenance dose. The length of treatment. How long is it going to take? Measuring and preparing correctly. And the rest period, what is too much activity? Again, you see this. Ask your allergist these questions. Don't be afraid to ask them and get clarity surrounding all of this uncertainty and ambiguity, because the more information that you have, the better chance you have of really dealing with what is really evidence-based. And also it can give you more confidence in your ability to make better decisions the more information that you have. Okay, now we're going to switch over to perceived danger. And remember, here's where we are. So you've got ambiguity and uncertainty that we just talked about, plus perceived danger equals anxiety and avoidance. So we're right here at the perceived danger part. And again, this graphic that I showed you before, perceived danger is high with that, and you get the highest anxiety. So here are some perceived dangers and fears surrounding food allergy and OIT reactions. Again, ask your allergist these questions. You want evidence to make decisions. What I see a lot in my practice is that there is a belief that, whether people realize it or not, that every exposure is going to lead to a reaction, which is going to lead to anaphylaxis, which will maybe end up in death. And that is something that goes beyond, behind the scenes in people's heads, that you really need to ask your physician. And I think that it would be great, Dr. Jones, if you could talk a little bit about this at the end, because it really is such a prevalent underlying thing that people have going on with anxiety. People really fear that they'll be incompetent to deal with the reaction in several ways. They feel like they're going to be incompetent to assess a reaction, treat it correctly, and also psychologically handle a reaction. We already talked about people's fear of death. I mean, it's very scary, obviously. People fear using the EpiPen, both administering it, and there's a lot of questions surrounding what happens if I use the EpiPen and my child wasn't actually having an allergic reaction. And again, that's something that I would defer to Dr. Jones on. They fear that an allergic reaction could result in trauma, both for the parent and the child, and also that each reaction gets worse. And that's, again, something that I would have Dr. Jones talk about. Okay. One thing that I want to talk about and really hammer home is that avoiding things that your allergist would say are reasonable things to do if you're having anxiety surrounding food allergies is most likely going to increase your anxiety. And I'll show you why. So this is kind of a cycle of what happens with anxiety in general, and more specifically with food allergies and OIT. So you have some anxiety surrounding the potential dangers of food allergies and OIT. And so you start to avoid things that your allergist would say are reasonable to do, and or start taking precautions that are your allergist would say are excessive. And so then what happens is your mind starts attributing your safety to this avoidance and unnecessary precautions, which offers some short-term relief, but in the long run, it actually increases your anxiety. And that's because you haven't learned to tolerate ambiguity and uncertainty, which are very difficult things to tolerate, but the difficult emotions surrounding that, which then leads to decreased confidence in your food allergy and OIT management, which then increases your anxiety. And so I'm going to give you some examples of what high anxiety food allergy individuals and families avoid. I am in no way saying that it is wrong to avoid these things, because I'm not your allergist. This is a very personal discussion that you have to have with your allergist to see if you are avoiding these things, if it's clinically necessary in their opinion. So some things that food allergy families avoid is food introduction, either for the food allergic child or a sibling that is not food allergic or food allergic. Parties, family gatherings, holidays, restaurants, having more children, eating at friends' house, traveling, possible contaminated surfaces, even after they've been thoroughly wiped down, having people to your home, school experiences, including field trips, extracurricular activities, summer camp, and basically overall just the avoidance of psychological distress, avoiding the experience of anxiety itself. This is some more avoidance that is more OIT specific. Avoid doing physician approved movement during the waiting period. So for instance, that might look like the allergist has told you that after the OIT dose, if your child needs to get up and use the restroom while they're watching a movie, then that's fine. But then actually asking the child not to get up at all during the rest period, that would be like avoiding doing something that the physician has approved you to do. Again, that's a talk with your physician. Extending the rest period beyond your physician's recommendations, avoiding emotional upset outside of the window of rest, excessively avoid emotional upset during the rest period. So that can look like a lot of like either with an individual or a parent with a child, emotional monitoring to make sure like excessive questioning that the child, or like it can be an internal question if you're an adult and doing OIT of, am I getting upset? What do I need to do to avoid to get upset? And then you can kind of see how that can lead you to actually get upset. Avoiding travel while doing OIT and avoiding introducing new foods while doing OIT. Okay, so now for the meat of it. This is the ways that I suggest that you try to, the things that will hopefully help with your anxiety if you're doing them kind of outside of therapy. So again, I know I've said this a million times, but it's so important. Ask your allergist the questions that you have, especially regarding the fears that you have and any precautions that you're taking that you feel like may be excessive. I just want you to ask them about all the fears that you have. Ask them for the real information on the fears that you have. Like, what are the likelihoods? What does the research say? We're getting to a point where we have so much really, really good evidence coming out that is evidence-based, especially with OIT. It's so exciting that probably from one year to the next, and again, Dr. Jones can talk about this because actually Dr. Jones is a leader in this. He runs an OIT group that has a conference every year, and the amount of information that they're sharing and getting out there, it's changing so rapidly, and it's so exciting that from one appointment to the next, they may know even more than they did from the prior appointments. So ask the questions. Be careful about where you're getting your food allergy and OIT information. Go to your physician, go to reputable organizations that are really solidly evidence-based. You want to assess your social media use because social media, I am noticing more and more, is very anxiety producing for a lot of people. And some groups where everyone can just share their experiences and everything about their journey. It can sometimes be helpful that you feel like your anxiety is more normal, which is really important, but it can also, there's a lot of misinformation in there. And also it can actually, some of the ways that they describe allergic reactions and things can actually be kind of traumatizing. So if you are getting on social media and you are consistently, your anxiety is consistently getting worse with that, you may want to assess your use of social media. Okay, don't restrict, avoid unnecessarily. Normalize anxiety and the difficulty of managing food allergies and OIT. Watch the stories you tell yourself. So, you know, if you're telling yourself stories like, just get over it, you're being ridiculous, why can't you do this? Why can't you just go to the park like everyone else can. What's wrong with you? The park should be fine. It should be safe. That kind of language and kind of putting yourself down and shaming yourself is actually going to make your anxiety worse. And so I would rather have you have self-compassion for the difficulty of this food allergy journey and also normalize that it's very difficult and hard. Make sure you're clear on your recommended action plan and practice using your EpiPen trainer. Build a support system that is either other food allergy families or just friends and family that are going to be there to support you, the kind of people that are going to ask you, what can I get that, or what can I bring that would be something that your child can eat? I'd like for you to try to shift from what ifs to even ifs. So what we can do as food allergy parents is go kind of down this path of what if this happens? What if this happens? What if, and our problem solving mind goes into overdrive in a way that's really unhelpful. It's obviously important to plan for food allergies to avoid dangerous situations, but doing that excessively in a way that gets you hooked where you've already really got a good solid plan and you keep going over and over it. I'd love to see people shift from what ifs to even if this happens, I'm competent to deal with the reaction. I've got my plan with my allergist. I know how to use the EpiPen. I have confidently dealt with it before. And even if there's been prior hiccups, I've learned from them and I know what to do. Just basically that you're competent to handle it instead of you're not competent to handle it. It's important to clarify your values for parenting and act in accordance with them. So you want to watch for a safety value overriding all the other values. So for instance, if you imagined yourself as a parent that was going to be very adventurous with your kids, and you've noticed that really that is not a value that you're really acting in accordance with because you're so just overly focused on your safety value, it's really important to figure out ways, maybe non-food ways, to honor those things that are important to you about being a parent at the same time that you're honoring your value of safety. Mindfulness, this could be a whole talk in itself. So I will just say, just kind of look it up. And what mindfulness is just being present with difficult emotions and approaching them kind of the way your mind is working non-judgmentally and with self-compassion. I want you guys to be nice to yourself, especially after an accidental exposure. This is an extraordinary load to carry. It's huge, and you're not going to get it perfect all the time. And that's when it goes back to that competency-based idea of you're not perfect. Something may slip by you, and you're competent to handle it. So remaining flexible with both food allergy management and OITs, both values. We talked about the values already, but OIT. So like with OIT, let's say that your kiddo is starting to refuse the food or having a really difficult time with the dose for some reason, but you've got this goal of they have to be through with it at this date, at this time, and we don't have any time to mess around. Talk to your allergist about maybe being flexible and hanging out at a dose for a little while until your kid is ready to move on. That's a discussion to have with your allergist, but just having kind of a flexible mindset surrounding OIT is enormously helpful. And if all of this is kind of too much and you need to see a food allergy therapist, if you can get someone that's food allergy informed, that's really great. So these are different time periods in the allergy journey when therapy can be very helpful. So at the time of diagnosis, after initial or subsequent allergic reactions, in preparation for an oral food challenge, before or during OIT and SLIT, new food introduction for either your food allergic child or a sibling, during childhood developmental transitions, If you need some help knowing how to talk to your child about their allergies and their own management and journey, and when you also need help talking to your allergist. And then I'm just going to close with some signs about when therapy may be indicated. So if you notice that anxiety is increasing as time goes on, or that your fear or worry is happening on a daily basis, or your anxiety is disrupting your ability to live in a way that is consistent with what you value, if the anxiety is bleeding into other areas, you're starting to feel chronic overwhelm, panic, or not able to introduce the new foods that the allergist recommends. If you notice that you're restricting food that does not contain or have the possibility of containing you or your child's allergen, or you're restricting in a way that your allergist would say is unnecessary. If your fear or worry is interfering with eating, one thing that I see is it can interfere with feeding your child, but it can also sometimes transfer to parents that they're actually worried about eating certain foods, that that they just develop eating issues with eating themselves.
Let's pass the baton on to Dr. Jones, and then we can do Q&A at the end of the webinar.
Hi, everyone. Thanks for joining. And Dr. Freeman, so honored to have you today. As she mentioned, an annual conference that I'm in charge of every year for allergists. So we present a lot of all the latest and greatest information specifically for allergists and their teams. And we were honored to have Dr. Freeman come and present to our group, and that's where I first heard her speak, and just was so impressed with her presentation, her mindset surrounding this topic, and she just gave so many great pearls, and once again delivered tonight. So I guess it's morning there, but so grateful for you in doing that. This is a topic that's just near and dear to my heart, because as I started food allergy treatment well over a decade ago, at the very first, it was new at that time, and there was so much focus on just getting the patient to safely consume the food and not have reactions and epinephrine use and all those things. And that was important to do. But I will say the most rewarding aspect was watching the transformation of their psychosocial journey. And it was just amazing to me as a newer doc at that time, not quite understanding or appreciating the significant burden that food allergy families would carry. I couldn't really grasp that until I saw it gone. And then when I saw that gone or minimized, and personalities emerge, and all just that transformation, that was the most profound thing to me as their doc, and watching people go through this. And ever since then, I have paid immense attention to what families go through and what burdens they may be carrying. And I think as allergists, and this is why it's important to me, and I think we need to do a better job of just bringing this up. Dr. Freeman talked about all the questions that patients should ask their allergist. I think allergists need to do a better job of asking the questions, well, and also saying, it's okay. It's okay that you have this. We understand, to where we can lean in with compassion, with validation, and just say, it's okay. We got you, and we're going to get you some help. And I think it's important that we start bringing it up more, and we address this all along the way. I'm a big fan of walking the journey together and trying to dispel the fears and dispel the myths. And I think the first step is just gaining that understanding with the patient. And if you can just acknowledge and validate, I think, a lot of their anxiety, now you can start to understand one another. And then we can kind of basically walk that journey and navigate it. And let it know it's okay, and it's fine to have those conversations. And I think that is one of the first steps, in my opinion, to overcoming fear, is just having that connection with a solid resource, because now there's that trusted source, and it takes some of the uncertainty, if you will, that Dr. Freeman mentioned. It starts taking that away. Just knowing there's a trusted source there walking the journey with you. I think it's very empowering. So um, I'm just very grateful for your comments today. This is something that we assess all the time in our patients, and hopefully they feel comfortable in talking to me, talking to our group, talking to their allergists. It's something that when I train other allergists across the world, it's something that I'm relentlessly talking about and trying to educate more of them on the important issue, and also the role that it plays. And the other aspect is whether somebody's getting treatment or not. We just, if you use epi, you have to go to the ER every time. I always say epinephrine's your friend in that case, and we need to use epinephrine to hopefully prevent an ER, or prevent, the things that you're so scared about. Um, so there's a lot of work that we have to do, but I think as we walk this together, and we get feedback from patients, and we understand more, we can shift those messages and understand what myths need to be busted, and what misinformation needs to be corrected, so that people just have that solid foundation of education, of understanding, of communication, and knowing that we can talk about this, and then shifting that fear to more empowerment.
About OIT only was through the online groups. So for us on this journey, online groups are the only source of confidence, of real information rather than misinformation about what's happening in the rest of the world.
It's an important question, because so my child also has a food. I don't know if we mentioned that or not. That's how I got into this work, is because my child has a food allergy, went through OIT, was in a clinical study. And when I was navigating this, I was just kind of incredulous that I was walking around and like, here's an EpiPen. And, now my child is now 19. So it's been a while, but that's really why I got into this. And the reason that I mentioned that is because early on, I got into some of the mom Facebook groups. And one of the things that's amazing about these Facebook groups is that these moms kind of came together to actually support each other when there wasn't, in general, a lot of support, frankly, from physicians, 15 years ago, 17 years ago, because they didn't understand the psychosocial aspect of it. And so it can be incredibly normalizing and validating. And it shows the strength of parents, and there's food allergy parenting groups too, but it shows the strength and the support that they're giving each other. And it is absolutely fantastic. I think what I would say is that if you see something in there that is causing you a lot of anxiety, it's very important to bring it specifically to your physician, because there is some misinformation in the groups, because kind of anybody can say anything they want to. And there are, like, for instance, I tell everyone to follow Dr. Jones on Instagram, because he's like doing these myth busters. He's offering a lot of support. And so I don't know, Dr. Jones, do you have any additional thoughts about that? Anything that you're seeing in your practice?
In which regard?
Well, just about just social media groups and kind of the positives and negatives of them.
So one of the things that I noticed early on, because I was in some of those groups about 10 years ago when they first started, I'm not in them anymore, but I used to. But one of the things that I noticed is you really have to be so cautious with the information there. So they can, as we've kind of discussed, they can be very, very helpful. There can be a lot of support there. But the one thing that I noticed is if a child had like a reaction or something, a lot of times you're not getting the whole story. Like somebody's going to put online the story they kind of want people to hear, but it may not be the full story. And some of the details that are left out are actually quite important. And it is so difficult sometimes to even compare that whatever you're reading. I always say you really have to filter and just take it for as a grain of salt, but also don't always take it to mean that's going to be the equivalent for your child. This isn't social media, but 2 days ago, just 2 days ago, I had a patient in clinic who, they had certain numbers on their tests and they were told all kinds of things on social media and they were terrified and they were comparing. They were comparing their situation to somebody else's situation. I said, you can't compare. You literally just cannot compare. And somebody's numbers cannot be interpreted in the context of somebody else. The numbers and the test results for a food allergy person is specific to that person. And I think that's also something that for those that see me on Instagram, it's like I talk about that, and have a lot, is you just can't compare those numbers, and you really have to talk to your allergist or somebody who's very familiar with all the nuance of the numbers. Because if you don't, that's where a lot of the misinformation and fear comes in. Again, social media can be helpful, but you really have to take it with a grain of salt and realize you're not going to get the whole story. You can't compare, and you really have to talk to your doctor.
Answers. We have a question actually as a follow-up from Anita. She says, what do you do if your child could do a food challenge based on numbers, but they're too anxious?
The child is too anxious, or the mom is?
I think it says they are too anxious, meaning the child. Yeah.
There's, if I would need a lot more information, but kind of my knee-jerk reaction is that it's just, I would need a lot more information, but we have to listen to the kiddos, because if we don't, then we can set it up to where they don't want to do anything. So, like in the worst case scenario, if you force a child in some way to do an oral food challenge when they're not ready, it could mean that they would have a horrible experience there, not want to do OIT later. Like the kids have to have a say, they have to have good information. And if this was something that was important to you, then maybe putting maybe getting the help of a psychologist or another mental health professional that could maybe talk to the child, ascertain the specific fears. Another way to be able to do that would be to talk to the mom. Like I could talk to the mom, find out more about the individual child, see how we could support the child. But it is important that you're listening to what the kiddos are saying, because you can really pretty easily, if you force them to do anything, turn them off of it permanently.
And not only turn them off it, but they can, if you force that and they're so anxious, they may end up vomiting and even getting hives around their mouth. And people say, oh, there's either it's like, but that's not necessarily an allergic reaction. You can get vomiting and hives actually just from the stress. And
absolutely.
Now you've delayed. And to your point, Dr. Freeman, it can become a really bad experience if it's not done at the right time and kind of the right environment with some of that. Granted, to some degree, with some help and coaching, you can help those children overcome that, and you can help it be a better experience. But it's definitely not something to be taken lightly.
Stress when your allergist is telling you that something, and you trust your allergist, and it's a good allergist, and your allergist is telling you that something is okay to do. For instance, they're telling you that they feel really good about you challenging a food at home or something like that. In these situations, or when you need to introduce a new food, in these situations, some of the things that I mentioned, so mindfulness is extraordinarily helpful. So look into mindfulness, and that is just kind of observing what is going on with you. You need to do it on a regular basis outside of actually these really stressful situations. But it actually helps you to develop a new, different relationship with anxiety. And something else that you can do is for your OIT journey, when you start, I recommend that you have some values that are guiding your journey that you want to get to. So for instance, OIT, a very common value is having some more freedom in your life to do things. So reminding yourself mindfully about what your goals and your values are in these really difficult situations. Sometimes we have to act, of course, if the allergist says that it's okay to do it, right? But we don't just kind of wake up and change our mindset and say, oh, I'm not scared anymore. What really helps with a change in your relationship with anxiety is doing things even when they are hard. And so, and then when you're doing them as they are hard, you get to get that competency that I was talking about before, that you can handle difficult things and you can do it.
Thank you. That's a great answer. Is there any particular strategy, Paige, when it comes to that moment of anxiety when, let's say, a child is really sick and you are yourself panicking? Is there any like a quick fix strategy that moms could adopt?
Unfortunately, I would love if I could give you some quick fix, but some lasting fixes are going to be that value work, and that mindfulness is extraordinarily important. It's one thing that you can look into is ACT. It's acceptance and commitment therapy, and it's kind of an offshoot of cognitive behavioral therapy. And I find it to be extraordinarily helpful with food allergy families. And it's basically just really getting in touch with your values, doing some mindfulness, having a lot of self-compassion, some of the things that I already mentioned. But unfortunately, there's just meaningful change is not going to be a quick fix. I wish it was. That would be great. But it's just meaningful long-term change is going to take a little bit more work. And mindfulness, I'm a huge believer in it.
Thank you.
I find it a bit tricky in terms of language with, I don't know if anyone else finds this with younger kids, or when we started OIT, we were sort of saying, this is going to be great, take this medicine and it means that you can eat whatever you want and you're not going to have to do this forever. And like we were trying to sort of entice him into doing it. So we were saying all this stuff. And then obviously as you go through the journey, you kind of realize that, hey, there's maintenance, there's, still rest periods to consider moving forward. It's not just 1 year and you're done forever. So how do you change the language where it's still for a younger child who sort of sees things as black and white and can't really see the gray area? How do you encourage them and entice them to keep going if they don't really see like an end in sight? If that makes sense. I don't know if that makes sense.
So I think that there's a real tendency to sometimes over explain to children that young in a way that they don't understand or frankly really care about a lot of the time.
Yes.
Right. And so, I think the least amount of words that you can use, and then just very naturally answer if they have any questions about it. Right. And so it is not overwhelming them with information that they can't understand. Right. And it's just like it as simple as you can. And a lot of kids especially at that age, like it's just not really that huge of a deal. Now, some kids it is, don't get me wrong. Some kids it is, but they don't need all of that explaining. And I don't know, Dr. Jones, what would you add to that? Is that kind of your experience too?
Yeah, I think keeping it simple, just as simple as you can, not overwhelming them with too much information. And I also tell people it does get easier. When when you start hitting some milestones, if you can kind of weather some of that storm, it gets easier when you start having a little more freedom and the children can start seeing that. So if we can just keep it simple, not overcomplicate it, getting kind of a routine where it's almost just like you brush your teeth every day, right?
Yeah.
Okay, let's just take our dose every day. You brush your teeth every day. This is just part of our routine, part of what we do for our normal health. And I just really like to just try and build it into that a sense of normalcy of this is just what you do. But then as you get a little farther along, I will say when that freedom starts coming in, it'll start clicking with the children. They'll be like, oh, this is why. I'm glad we did that. For the most part. So the next thing I would say is also give yourself some grace. Sarah, you've gone through a lot, and give yourself some grace along the journey. You're doing really well, and don't forget how far you've come, and celebrate, some of those successes along the way.
Thank you.
And I think one thing that I would like to add is that kids, a lot of us have grown up with no food allergies, right? And we had this preconceived idea about what life with our kids was going to look like. And a food allergy probably was not in that equation, right? And so as parents, this food allergy can be a real loss, and there can be a lot of grieving over the food allergy. But kids have, especially this young, this is the way that they've always been, and they aren't grieving a loss. And sometimes we assume that they are when they're just actually just become accustomed to this. Not even accustomed, because it's just the way it is, right? And so we assume that they've got all these questions and all of these, hang-ups about it and everything. And sometimes they just really don't. And so just keeping that in mind, that our experience is not our kids' experience.
And why is that the most challenging age?
Because it's just a normal developmental transition at that age. And that, you bring up an interesting point. One of the things that is so difficult about food allergies, and I mentioned it just very briefly in my presentation, is that there's different challenges at different ages. And with teenagers, this is the challenge, because that is a normal developmental thing kind of that they're supposed to be doing. They're kind of testing their boundaries. Unfortunately, it can not mix well with a food allergy at all. So it's not necessarily that there's anything wrong with them, but what I think, you didn't really ask this, Nina, but what I think it's really important to do with teenagers is be a team and not get into the kind of like being a dictator about all of the things that they have to do. This is a developmental time when you're going to start to ask them things like, very casually, you're going to this party. Have you thought of a plan for your food allergies? Right. And I have teenagers that have things that they do that are very well thought out plans that are maybe some risk-taking behaviors, but they have also decided ways that they can mitigate their food allergy risk-taking and kind of do some risk-taking that is a little bit more safe and controlled. But it's really hard being a parent of a teenager with a food allergy. When I do therapy with people, one of the main things that I do is we talk about what is helpful for anxiety and what's unhelpful. And that is a lot of the meat of what we do. And having someone that knows about food allergies, and I know that is not a lot. I don't know what your level of availability is but I hear, Sarah, a lot that people who have been to therapists who don't know about food allergies have either kind of spent a lot of time trying to educate the therapist about food allergies, and sometimes I've seen it in some cases actually do some damage to patients when someone who doesn't know about food allergies does therapy with them.
What are some of your thoughts on that, expectations of the length of the OIT process, and what are the sort of strategies to manage that? Is it self-talk, and what do you think?
I think just really being flexible, like I said, it's so important to go into OIT with a kind of a flexible mindset of we're going to get done when we get done, right? Because when you don't, like when your kiddo gets sick or whatever, you feel like, oh my gosh, what does this mean? We're going to have to go back 3 doses that we were doing 4 months ago. What is going on? You know what I mean? And so if you don't come into it flexibly, then I think you're setting yourself up for disappointment. And it may go, occasionally it just goes right along, but people get sick. Sometimes things come up. Sometimes you just skip your dose because your kid just will not take it that day or whatever. So building that into your expectations, especially if you can do that initially, like having the mindset of, we're going to just get through it when we get through it. And that's fine. We're going in the right direction. Even if we have a setback, we're still going in the right direction and we're still going towards the goal.
On behalf of all our listeners, followers, and supporters, we would like to sincerely thank Dr. Paige Freeman, licensed psychologist and food allergy therapist, who joined us today from Houston. Her work is on Instagram, and you can follow her handle, which is @anxiety_psychologist. We would also like to thank Dr. Douglas Jones, MD, allergist immunologist from Utah, USA, for his valuable commentary. You can follow Dr. Jones's work in the food allergies and microbiome myth-busting space also via Instagram. His handle is @DrDouglasJones. Thanks to everybody who managed to participate in today's webinar, turned into a podcast here, and we look forward to welcoming you also in the future. Have a great day.